Dr. Fine, as a sexual therapist specializing in sexual problems that can affect couples after first-line prostate cancer therapy, do you recommend that men and their partners address potential issues before treatment so they're prepared for the worst? Or do you think it's better that they hope for the best and deal with problems associated with erectile dysfunction if they arise later?
I don't think we hope for the best and prefer not to be educated in any other circumstance. So I think it's very important that people become educated, that people get their information from medical professionals, and they learn what's ahead of them, or might be ahead of them, so they can plan for strategies that can combat that, they can have realistic expectations, and they can go through it together. I think when people experience something that they have not anticipated, it creates an anxiety. Anxiety adds to ED. So I think telling people what might be ahead, telling people that it's normal, whatever normal is, will give them comfort. And I think when people feel comforted and cared for, you have better outcomes.
In your experience, is so-called penile rehab using PDE5 inhibitors like Viagra and other forms of drug therapy becoming more common today? Are urologists more willing to address these issues with their patients before treatment?
I think the medical profession is starting to think of sexual health as a legitimate problem. I think that more and more people are becoming comfortable discussing sex and sexual concerns, but we have a long way to go. I believe that prostate cancer especially should have multiple professionals, and I think that people feel more comfortable and cared for when their specialists work together. I think that urologists are becoming more comfortable talking about sex, but we're not quite there yet. And I think the psychological aspects of cancer combined with the devastating side effects of ED and therefore side effects that affect their relationship with their partners need to be discussed and counseled by someone who can address those concerns.
Can you give us some guidance as to how, in your experience, the views of wives and partners about erectile dysfunction and other aspects of sexual function post-treatment differ from those of the men involved?
Like anything else, but especially sex, how people dealt with their sex life before and how comfortable they were communicating about sex before largely affect the outcomes after. And that's why pre-counseling is very important. A therapist this way enables somebody to become more open with their sexuality. They give them permission to discuss these things. And with that permission and with that communication comes camaraderie, which leads to intimacy. Women foster intimacy. So women get very excited about the fact that now is a good opportunity, maybe for the first time in their marriage or their relationship, to be able to discuss these things. And they feel that because a professional told them to, that they have to, so it gives them an excuse.
Often the single biggest problem may be the fact that a couple doesn't know how to discuss the problems of erectile dysfunction at all. What do you recommend when one or the other partner, or both, seems unable or unwilling to even start this conversation?
The element of shame has always been with us culturally, and if we're embarrassed or inhibited in any way in discussing sex and what we would like and what new things we might be able to try, when it comes to post-op prostate cancer, we might need to shift the way we do things. And if we're uncomfortable discussing sex, then we're going to be uncomfortable after discussing sex. In addition to which, if the man is afraid and fearful that he will not be able to perform, he starts to avoid any type of intimacy that might lead to sex. And that leads to anger, frustration, and blame, which are very harmful to a relationship. it's very important that a therapist be able to teach a couple how to discuss sex. One of the best ways to start is by having people discuss their feelings rather than what's going on. So for a woman to be able to say, listen, I miss feeling close to you. You know, it's not the actual intercourse that I miss. I miss our intimacy, I miss our hand holding, I miss our connection. Talking about feelings is easier than talking about outcomes. And when you get comfortable talking about feelings, then the process can start to take place. And mind reading is an enemy when it comes to discussing sex. So fostering communication, teaching people how to communicate about sex, educating them, and fostering strategies that a couple can take care of together is the most important thing, because you want to walk down that road together.
Other than erectile dysfunction, what are other critical issues of sexual function that prostate cancer patients most often bring to your office?
There are other physical manifestations of prostate cancer, such as incontinence, incontinence with orgasm, having a weak pelvic floor, other medical problems. There's penile shortening. But the greatest complication, aside from ED, that I see is a deterioration in self-esteem, depression, anxiety, and how it affects their relationship, because that affects their quality of life.